be here the rest of the day. If anyone wants to talk with me, I will be available if you have questions about this. The Bristol School Chart is available for free on the internet. I suggest you put that in your toolbox. Okay, always look at that medication log, give you a heads up what they're real, because they'll say, no, they don't have reflux, no, they sleep through the night, and then you realize they're on enough melatonin or clonidine to put down a horse, or they're on Nexium, or they're, you know, so they just get used to it. Okay. Let's get to the 2 cases, because that's where you're really going to kind of learn something. All right, pediatric case. I want you to keep in mind these 2 slides of areas that we went over. And we're going to look at little Thomas, age 4, who came to see me. He had the alphabet soup. He was labeled with that old term, mental retardation. He was actually in the MR classroom, as they call it, in West Virginia. And Mom thought he was really smart. I have this happen a lot, where the kid's got a bad label and Mom thinks he's smart. So what do you do with that? So I'm thinking, is that permanent neurological deficit, or is the brain just under attack? In red, I'm putting my clinician thoughts. Okay, we kind of went through all those areas real quickly. So this is how I look at the history. The thoughts in red are my clinician thinking. Okay, he actually had pretty good color. Usually they're pasty. He did have poor eye contact, a little puffy for allergies under his eyes. And he had that flat affect, and he was as crabby as could be. So I'm thinking, is this pain behavior? The flat affect, is it opiates? Is it oxidative stress, inflammation? Who knows? He only had 3 antibiotics in his life. Okay. The birth wasn't too remarkable. He seemed fine. He did great for the first year of life. Usually we see colic and reflux and they can't sleep and ear infections, and he really didn't fit that. However, despite this clean history, by 1 year of age, Mom's radar was going off. Pediatrician and nurse are like, no, let's move on. Mom's going, something's wrong here, and she switched pediatricians. Then it started between ages 1 and 2. The disturbed sleep patterns. This was a very exhausted family. So right away, sleep patterns, what am I thinking? Reflux, okay? He didn't want to go flat. That bag of acid can just wash up the esophagus when gravity's gone. He never stopped moving. Once asleep, he stayed asleep, constantly moving. To me, the pain's not bad enough to wake him up, but he's not having a restful sleep. I had a child this week come in on, gosh, it was a little kid, on a medicine for Parkinson's, for restless leg syndrome, because of this restless sleep pattern, okay? And he did wake up some at night, but it wasn't too bad, so I didn't think his gut was too bad. Let me tell you right off the bat, Thomas is a Cinderella case. We get results like this all the time, usually not this fast. He's a good, fast responder, so. He was meeting physical milestones. That language wasn't where it needed to be. He would point, but he would grunt. He wouldn't use language. He was rashes all over. So I'm thinking there's studies linking eczema and rashes to yeast in the GI tract. Those are in your notes for the intake. They're on the side there, okay? He would get this flushing red thing. So I'm thinking food sensitivity, IgG sensitivities, or phenols. I'm not sure what's going on there. He was pooping every day, but they said they were hard and huge. You know, I get that pattern too. Very foul odor, itchy bottom in my office, you know, really digging there. So I'm suspecting dysbiosis. On that first visit, he could only string together 2 or 3 words in a row. He didn't say I or me, he'd say, Thomas wants juice. He had this whiny, irritable voice. But he seemed smart. I'd send him up to get stuff from my receptionist. He could perform any task. He just had, it wasn't a diagnosis, but he just didn't look intellectually disabled to me, okay? Vision, what's going on here? Sideways glancing, that lazy eye history. They go like this to a ball, and it still hits them in the chest. You know, they can't see that ball very well. Very hesitant on the stairs. If you don't have good depth perception and your eyes aren't coordinated, that's a tip-off about the stairs. So he's going to get a referral there to the optometrist. He was eating a lot of foods. And my son was like that too. But the typical American diet can hide an addictive eating pattern. American diet, even an organic one, has a lot of wheat and dairy in it. So don't let that fool you. So I was looking for a lot of gluten and casein because of his aggression and behavior difficulties and his red cheeks. I'm looking for salicylates, which would be the Feingold diet, or phenols. Okay. He would drink the whole gallon. I love this, even white, if you let him. I guess he was drinking chocolate. But loves pasta, only eats the breaded chicken. Here's a 4-year-old who will eat tomatoes and green peppers like an apple. Maybe they're delicious, maybe it's the salicylates in them, maybe he needs a little Feingold diet. And he would drink coffee every chance he got. And all I can think is that's a methyl donor for that methylation cycle that's usually so poor. Pasta makes him aggressive. So we know he's got food sensitivities, possibly opiate, possibly phenols, possibly salicylates, who knows. That silly drunken laughter all day long when nothing's funny and they just can't quit giggling. We think yeast. If it's only at night, we think phenols. He had a lot of fungal signs, flakiness. And he was chewing on his clothes. Okay, we always give zinc for the chewies. We're assuming they're not absorbing their minerals from their inflamed intestines, and so we give zinc or magnesium. He had pain behavior. You can find my tongue here. He was constantly putting pressure on that tummy, and they just thought it was autistic behavior, to be honest. Random sadness and irritability. If you see random irritability, random self-injuring, it's not random. It's usually due to that internal pain that no one can see. And they think they're just, crazy or something. And he would fall asleep propped up. That's a tip-off. That's the reflux position. Okay? All right, so what was the treatment plan? I would have loved to have gotten him on the diet, but in West Virginia we do the enzymes with DPP4, which attacks and neutralizes those opiate peptides. You have to do it very gradually, and you will throw them into a full-blown withdrawal, and it will get very aggressive and nasty. We did some probiotics. My first pass at an antifungal was Saccharomyces boulardii. Does anyone use that? Favorite supplement. Heals the gut, balances out the immune thing going on in the gut a little bit, hates other yeast. We gave him some zinc. I don't do everything at once. I only start one thing at a time because they're so sensitive, okay? Even the probiotics I break in over 2 weeks because they cause a lot of gas, and I only do probiotics after their bowels are moving. Okay. We took out caffeine, sent him to the optometrist, and I was talking up the Feingold diet to Mom. She did not want to do it, of course. He came back in August, a few months later. Good color. Under eye circles were better. His eye contact was better. His mood was better. Okay? He is a sleeper. Mom had makeup on and her shoulders had come down a little bit. Okay? And once he's asleep, that body is peaceful through the night. Okay? He's not thrashing. He doesn't have restless leg syndrome. That was, pain that was enough to disturb his sleep but not to wake him up. Okay. His bowel movements were all over the place when she started with these enzymes and things. Opiates are very constipating. That's why these kids are constipated. If they have diarrhea, I suspect a bacterial overgrowth. Sometimes it's alternating constipation and diarrhea, and no one ever explains that you can have a big impaction of stool at the end of the colon, but your child's still eating food. It mixes with stomach juices and gallbladder and pancreas, and it's a slurry, a liquid slurry. And if there's something blocking the tracks up here, that liquid poop is going to come around it. And it's not really diarrhea, unless they have fever or something, So that makes sense to have that alternating pattern, diarrhea and constipation. The smell was normal. Usually we work on that for months and months and months because we think there's yeast or bacteria or something. Okay, pain behavior, completely gone in a few months in this child. All right, that random irritability and sadness, completely gone, and he can fall asleep and have a good night's sleep perfectly flat. How simple. Well, it was so simple. I can get people in West Virginia to do it. You know, we don't need clonidine and melatonin and Risperdal for this. Okay, I'm not saying it'll fix every case, but you at least need to give this a shot and rule it out. Even spacing out that enzyme, breaking them in over 4 to 5 weeks, he had a huge spike in aggression. Week 3 is famous for the spikes in aggression. Mom said she didn't know if she was going to make it. However, his bowels are moving better. Okay, he's flushing himself now. He'll eat anything. He branched out beyond the 25 foods. Okay, he's now asking for new foods for the first time. There's no reason to keep eating the old ones. We've broken that, okay? We started the probiotics on week 5 after we got his bowels moving, after breaking down those opiates. And we saw a big spike in aggression. When yeast die, it's very stinky. They dump a lot of toxins. They get crabby, and there's a lot of gas. His eczema is gone. You know, in his case, his eczema seemed to be tied to yeast in his GI tract, at least. And he's no longer chewing his clothing. Can you believe all these changes? Enzymes, probiotics, and a beneficial yeast. Okay. He was calmer. He was more affectionate, which Grandma was really loving. He had a better sense of humor. He was playful. He was demonstrating in my office that day sharing and imagination and empathy and curiosity. He said I and me now, okay? He was asking what, why, where, when questions. Just a complete 180 on this child. We can get these changes. Some cases are this fast, but most of them it's over, 1 to 2 years. We see a lot of rapid change in the first few months though. Yes, and it's addressing the things we went over earlier. If he had the opiates on board, the enzymes would take that out and get the bowels moving, which would help his reflux, which would help his sleep, which would help his irritability. Everything's tied in with that gut for this kid, okay? I personally don't adjust because my career, I didn't practice for 14 years, but I do have a chiropractor across the hall that I send to. Craniosacral especially is very effective with these children. Or functional neurology, you need to look up and find someone who teaches functional neurology for the autism spectrum. He can get his feelings hurt. He was aware that he was talking too much. Now he talks too much. Remember, he only had 2 to 3 words in a row. And he was driving them crazy. Full sentences. He's wearing his prism lenses. They said right away he started running up and down the stairs. He suddenly could make sense of his world. Okay, so what do you think that's going to do for him? He was only 4. He was just starting kindergarten when he came back in the fall. So we hadn't really gotten into academic deficits. But what do you think those classes are going to do for him academically? Which really affects his whole future and his career and everything. I cannot, actually. The optometrist would have to explain. They are therapeutic on the brain. The prism lenses he's asking about. If I wear my little bifocals all day, at the end of the day, my eyes haven't changed. But these are therapeutic and force the brain to use the eyes together, as does the computer-based vision therapy. And oftentimes, they have to come back every 2 to 4 months and get their lenses upgraded. It's not a once-a-year optometry visit. It's therapeutic, and it actually will help correct the problem, if I understand them correctly. So. Okay, the school tested him when he came back to school, put him in a regular classroom. He was talking so much they didn't think he needed speech therapy. Here Mom's been Googling on the internet and she's ready to start detox. Now, autism parents and chiropractors, of which I'm both, we love to treat yeast and we love to detox. We talk about that all the time. The two do not go together. They have to be done. You have to get gut readiness, and get yeast under control, and get everything working before you would even consider testing for detox. Because any form of detox, even something like the far infrared sauna, enhances yeast in the gut. and you will fight yourself and you will have a yeasty mess. So